What's going on, Q-Bear? This your boy Shed G. I'm here at Brookdale Health, and introduce yourself to the Twin Cities. I have a doctor here, and we're just going to talk into it. So let them know your name and what it is you do here at Brookdale Health.
My name is Dr. Talbot. I'm a physical therapist here at Brookdale Health.
Right, and Dr. Talbot, you do a lot of things as far as the physical therapy, and let's get straight into it. We're going to ask some questions. One thing with the situation is, what is a fear of people coming to deal with you at Brookdale Health with physical therapy?
When people first are in an accident, they hurt. When you hurt, you don't want to be poked at and prodded, and many times these people don't want to move. So when we tell them they're going to do physical therapy, they're very fearful. They think we're going to be doing very strenuous, difficult exercises that are going to hurt. But in fact, the opposite is true. Mm-hmm. We get them moving as pain-free as possible. We tailor these exercises to their needs, and it's depending on their past medical history too. Mm-hmm. And they're usually surprised to find that once they start moving, they feel better.
Okay, now what's an approximate time for them until they at least get back to at least 75%?
It's usually 3-4 months to get better after you're in a car accident.
Okay. Now, some of the things with the stigmas of, what would you tell somebody? Because, sometimes we don't want to, and I say we because I'm human. If you assign us some things and we don't do it, is that a bad setback for us? Or what would you suggest if we think about saying, well, I'm going to just skip today or whatever?
If you do your exercises at home, it's going to help speed up that healing process. Mm-hmm. And with people coming into treatment, they're still going to get better if they don't do their exercises at home. But if you do them at home, it's just going to speed things along. Mm-hmm.
Now, some of the 3 things that physical therapy would help accident victims with are, what are some of the 3 things for, I can't remember what they are, strength?
We help improve their motion, their strength. It helps decrease pain, and it also helps promote tissue healing. Your tissue is injured that's what a whiplash injury is. Mm-hmm. And by doing exercises, it helps remodel that tissue and promote healing.
Right, and one of the things I was talking about too was flexibility, because that was one thing that when I went through the process and we did some of the stuff with you, and we filmed the video, the flexibility was some of the stuff that you wasn't forcing me to do too much, but you still was making me do enough.
Yes, we do these exercises within the patient's available range of motion, and then when that motion improves, then we increase the exercises based on that.
Right. See, and I would just say that was great of what we were doing. And what if somebody, I know that you said that sometimes some people do not want to do it and they don't want to force, and what would you say to them? Because it hurts.
Come in, see us, and we will make you feel better.
Right, and that's one thing you want to do is make sure you come see us at 5740 Brooklyn Boulevard, or give us a call at 763-561-4045. We've been here 30 plus years, the same location. We're experts in auto injury treatment, and when I tell you, the physical therapy was great. I did the chiropractic, and I'm going to try the massage and stuff a little later, but the physical therapy helped me out a lot. Just seeing some of the stuff that you do, and last but not least, before I let you go, the equipment that you use is so high tech.
Yes, you must be talking about MedX.
Yes, that's what it was. We was on that. Tell us a little bit before you go about MedX.
MedX it's specific machines. There's one for the neck and one for the low back. These machines are hooked up to a computer, and they measure your motion, they test your strength, and then they graph it on the computer for you and compare your strength to they compare it to what's normal for you based on your age, height, weight, and gender.
And that in itself was amazing to see. And I would just like to say I thank you so much for tuning in with us today, and you coming here and sitting with us today, and we really appreciate you.
You are welcome. I love it.
All right, Q-Bear, swinging things back to you on 89.9 KMOJ.